Hey guys, welcome again to the PolYneer podcast. Today we are excited to talk about lung cancer and how we are working to find a solution. So take a seat and let's get started.
First of all, let's go over what lung cancer actually is. Basically, when lung cells grow and divide uncontrollably, they form a mass of abnormal cells called a tumor. If left untreated, lung cancers can spread to other parts of the body.
Hey Hasin, since we only mentioned non-small cell lung carcinoma in our previous episodes, is this the only type of lung cancer?
Well, I'm sorry, but that's not correct, Vivian. There are two main types, non-small cell lung carcinoma, in short NSCLC, and small cell lung carcinoma, SCLC. NSCLC is the most common, accounting for about 85% of all cases. It's a serious issue since lung cancer is the leading cause of cancer-related deaths worldwide.
I don't want to get lung cancer. Are there any treatments available for it?
No need to worry about lung cancer as there are several treatments available, including surgery, radiation therapy, chemotherapy, and targeted therapy. However, each of these treatments has its own limitation and potential side effects. For instance, they may not completely remove all cancer cells, or patients may develop resistance to certain drugs.
Hey Hasin, what do you know about the current treatments available for lung cancer?
Well, Vivian, surgery is the most common treatment for early-stage lung cancer. Surgeons remove the tumor and some surrounding healthy tissue, but it's not always an option. For instance, patients with poor lung function or other health issues may not be able to undergo surgery, and if the cancer has spread, it may not be very effective.
You're right, Hasin. Another treatment option is radiation therapy, which uses high-energy beams to kill cancer cells. It can be used alone or in combination with surgery or chemotherapy. However, radiation therapy can also damage healthy tissues, leading to side effects like fatigue, skin changes, and difficulty swallowing.
That's a good point, Vivian. Speaking of chemotherapy, it involves the use of drugs to kill cancer cells or stop their growth. It's often used alongside other treatments, but it can have tough side effects. Nausea, vomiting, hair loss, increased risk of infection are just a few, and not all patients respond well to chemotherapy.
In addition to chemotherapy and radiation therapy, there's another form of therapy called targeted therapy. It is a newer treatment that targets specific genes or proteins that contribute to cancer growth. Although it has shown promise, not all tumors respond to it, and some tumors may eventually develop resistance.
Yes, you're absolutely right, Vivian. And lastly, I want to talk about immunotherapy, which is a treatment that boosts the body immune system to help it fight cancer. Some patients have seen amazing results, but others have experienced severe side effects or no response at all.
While these treatments work for some patients, they all have their limitations. Many patients still have a poor prognosis, and the long-term side effects of treatments can significantly impact their quality of life. That's why our project is so important. We are now working on a new approach to lung cancer treatments that aims to overcome these limitations and improve patients' health.
Our project is all about targeted therapies, specifically using osimertinib as a first-line treatment for NSCLC. It's a tyrosine kinase inhibitor that targets a specific mutation in the EGFR gene. This mutation, called T790M, is found in about half of all NSCLC cases and makes cancer cells more resistant to standard EGFR inhibitors. What osimertinib does is block the mutated EGFR protein's activity, which slows down the growth and spread of cancer cells. Clinical trials have shown that it can really help improve progression-free survival in advanced NSCLC patients with the T790M mutation. But like with any other treatments, drug resistance can still happen. So Vivian, do you know why this happened?
Of course, Hasin. One reason for resistance is the development of new EGFR mutations, like the C797S mutation. It will make EGFR protein less responsive to the drug. Another reason could be the activation of alternative signaling pathways, such as MET signaling pathway. This allows lung cancer to grow despite the presence of osimertinib.
Yep, that's why we are working hard to find ways to tackle drug resistance and improve patients' outcome. That's why we are focusing on 3 things. Do you know what they are, Vivian?
Of course. The first one is health impact, because we are trying to develop new solutions for osimertinib resistance NSCLC. This could mean better treatments, longer survival times, and less suffering for patients all over the world.
You're absolutely right. What about the second one?
And the second one will be about education and empowerment, because we are not just focusing on our project. We also want to share our knowledge about synthetic biology with the community and inspire others to use it to solve local problems.
That's a nice one. What about the third one, Vivian?
Oh, I'm not really sure about that. Can you tell me more about this?
Oh, it's global collaboration. It's the most important one, as we are part of the international competition called IGEM. So we are not just working on this issue in Hong Kong, but we're also collaborating with teams from all over the world. Together, we can make some real progress in the fight against NSCLC.
Thanks for your kind sharing, Hasin. So that's all for today's episode of PolYneer Podcast.
Thanks for tuning in, and we'll catch you in the next episode.